Welcome to Healthy Pets, Healthy People. I'm Dr. Edmund Sulkowski. You know, I have to tell everybody that this show is about education, and that's our whole purpose here. We're not here to entertain you, we're here to inform you and to empower you. And it all actually starts from this studio here at the Peters Township High School with the wonderful teachers here like Mrs. Robin Frick, and the staff as Kelsey Silvestri and Mr. Bonai. But the main purpose of this education is the students here learning how to operate this equipment. So this whole program is based and surrounded by education. And our guest today, Dr. Dennis Courtney, is about education. Dr. Courtney started as a teacher himself before he became a physician. And as a physician, he not only treats patients, but he educates them as well. Let's welcome Dr. Courtney to the show today. Dr. Dennis Courtney, welcome to Healthy Pets, Healthy People. I always appreciate you taking time out of your schedule to come here and help our audience learn about being well. Dr. Courtney is going to discuss today stem cells, which I think is the future of medicine, and I think you agree with me on that. And also we're going to talk about something new for the first time on the show, something called exosomes. And I think that's going to take wellness to a whole new level. So, Dr. Courtney, just for the audience sake, give us a little bit of background about how you transformed yourself from being a educator as a teacher in the school system to a physician educator.
Yes, well, medicine as it has evolved now is my fifth career. So there have been 4 fully actualized careers before medicine came around. Each one has helped me and molded me into the person I am. But it all harkens back. It all begins with the first of the professions, which is a high school teacher. I'm very comfortable when I'm here visiting this school system.
Feels like home.
Because I worked within one only a few miles away for 7 years, enjoyed that job immensely. I just have a knack to take difficult concepts and simplify them. And did that 5 periods a day for 5 days a week for over 7 years and enjoyed it. But as I left it, the art of teaching never left me. And so I continue to teach to this very day. If you ever come to see me as a patient, you know that, because from about the time we meet until the time you leave, which probably won't be for at least an hour, I don't just shut up.
Yeah, that's for sure.
And we're talking about their medical issues and addressing them and putting them in a way that they can understand and that nobody ever took the time to explain it to them before.
And that's actually one of the complaints I hear from people, is that the physicians don't take time to talk to them and explain. They just dictate and here's a script and leave.
Poor doctors don't have the time. They're under the gun with the insurance companies. The volume of patients they have to see literally takes the ability to use that kind of an art out of their hands. They're told they're going to have to see patients once every 5 minutes. I think I may be even overstating that. And you just can't ever get down to any teaching concepts if you're limited to 5 minutes or less time.
They have to see so many patients in so much time, and it's.
So says the insurance company.
Yeah, you know, our lives kind of parallel a lot. I come from an education background as well. My father was a high school teacher, English and history, and then became a school administrator as a principal. And I grew up in the schools. I used to be one of the people that passed out all the books and the pencils and papers. I got coerced into doing that by my dad. So I spent a lot of time in school. And even after I got my medical degree, I went back and taught at Case Western Reserve. And I always saw myself as an educator, even while I was practicing, because patients would come in and they have fear. They have fear when you're in the dental chair. You know, it's very common. And one of the ways to relieve that was to explain the procedure and the outcomes, the potential outcomes. And people would say, no one takes the time to do that. We really appreciate it, because it is education. Education is power. So this stem cells that we're talking about today is so new, people are so unaware of it. What is a stem cell?
These happen to be cells which are blank, that we have in our bodies, which we can harvest and then administer them to either the same person or to someone else, and have this cell take on the characteristics of whatever organ they happen to be landing on. So you take these cells, which have been, in my case, obtained from babies, newly delivered babies by scheduled C-section. At the time of that C-section, after the baby, healthy as it is passed off to the pediatrician, the surgeon turns back to the mother and delivers the placenta and the umbilical cord.
So the cells, these undifferentiated cells, meaning they have no identity, don't come from the baby, the newborn baby. They come from medical waste, the placenta, the umbilical cord.
It's exactly right. And at that stage, at the newborn stage, these little critters just are seething in stem cell, which we then harvest and then cryo, freeze, and I'm going to administer them on another day to anybody.
So why do you do it under C-section?
Well, when it comes to the public being involved with the ability to receive stem cells, a program had to be devised in order to do that. That was orderly and that could actually be done sort of on schedule. So the one thing about scheduled C-section, not C-section, because many of the first C-sections are emergent. No one planned on it, it just had to happen. But after the first C-section, then it's planned. And so we know the date, we know the time, and knowing the date and the time, this allows an orderly movement of the mom to the operating room. At that point, then the delivery occurs. But there is an awaiting team that was dispatched by one of 7 companies. There are 7 companies in the United States that actually are in the business of harvesting and processing these kinds of stem cells. And so the surgeon delivers the cord and the placenta and hands them off to the awaiting team that was dispatched by those 7 companies, return back to home base with the organs, and within 4 hours of return, process out all the stem cells contained in those products.
So is there a certain amount of time that those stem cells are viable, that they have to be processed?
You know, they're processed within 4 hours, but then they're cryoed. They are frozen. And once in the cryo state, they can remain in that state for 20, 30 years beyond.
Are all stem cells the same?
And a stem cell is the same. Stem cell is blank. And the concept shouldn't be that challenging, because at the moment of our conception, every one of us, for at least the first 3 weeks of our existence in utero, we were nothing other than a cluster of stem cells. No lineage had been determined, no differentiation had occurred. They were just blank, and they flourished. At about 4 weeks, embryology takes over, and various layers, endoderm, ectoderm, mesoderm, begin to develop, and the organs within each of those layers start a tract that allows decisions to be made. That stem cell makes a decision to become, well, fill in the blank.
So some chemical or electrical impulse starts to change those stem cells.
Biology happens. It's been going on since the beginning of time. I've actually wondered, why did it take so long for us to get here? Because this is relatively new in terms of where we are and using stem cells. They should have been able to be doing this a long time ago, and they haven't.
Well, it is new, but in all honesty, I never heard anybody in this area talking about it until you started talking about it.
I was one of the first. What I really feel is important is that the public, they're very attuned to discussions about stem cells, especially those with advancing age, because as they hear about this stem cell, there's an allure that attracts them to the point where they think, they wonder, geez, I wonder if that stem cell could help me with my whatever problem that is. And in fact, that's a pretty healthy exercise, because I think stem cells can help with just about any of the medical problems, and it will be so as time moves on. It's going to be that the stem cell in the next decade goes through the roof.
Well, we entitled this show today, Regenerative Medicine. And the reason is you're actually rebuilding tissue with a stem cell.
Yes, we are regenerating brand new tissue where once diseased and poorly functioning tissue existed. The classic area are the joints, because that's really where stem cells as a therapy began. And as we advance in age, a lot of people were afflicted with, well, knee, hip, and shoulder issues. In the orthopedic world, the ultimate resolution of those kinds of problems really turn out to be a joint replacement. It's a miraculous thing that these people have the skill to do that. However, I'm thinking that the public really would like to know, do they actually have to? And I believe what I've learned in these last, going on 4 years now, coming up soon, is that these surgeries appear to be obsolete, and that you don't have to submit yourself to a joint replacement. You can regenerate a brand new joint from the previous one by using stem cells.
Without being a mechanical person after an implant. You have an artificial knee or artificial hip. This is actually causing your tissue to rebuild itself.
Yeah, exactly what's going to happen. And of course, there's no anesthesia here, there's no downtime, there's no rehab. Literally,
the risk is way reduced.
Compared to a surgery, this risk is minuscule to virtually none.
I want to back up a little bit and talk about these stem cells, and then I want to go, after we explain exactly what those stem cells and why you use the procedures that you use and the stem cells that you use, we're going to get back and go back to these joint issues and talk about some of the ways that we can regenerate these joints from the certain diseases that occur, or even injury to some degree.
Sure.
So I know from talking to you over these last few years regarding stem cells, and you appearing on my radio show, Healthy Pets, Healthy People, you take a specific stem cell that's harvested and processed a certain way. I've talked to other physicians about stem cells, and a lot of them are using a stem cell from the patient themselves. Would you contrast the two differences and why you chose to go with the one you did?
Yeah, this is part of that educational process. The public needs to know certain things before they venture out into the marketplace, because to do so without a basis of understanding really exposes them to vulnerabilities. So the first step, I believe, in trying to get this across to the public is to tell them that there are two kinds of stem cell. One is referred to as autologous, and the other is referred to as homologous. When stem cells first made it into the medical realm, all stem cells were autologous, and by definition that means that they come from you and they go back to you. You are both the donor and the recipient. The two body fluids that get harvested are either body fat or bone marrow. They're extracted from the patient. Then, once extracted, the cells are manipulated over a 3-hour period to collagenate them, to centrifuge them, to wash them. Anyway, this goes through an extensive process, and after about 3 hours, we're left with a smudge on the bottom of the last test tube, for which the doctor points to and says, you see right there, those are your stem cells. So that when stem cells as a treatment began, all stem cells were autologous. There's a problem, however, with autologous, in that as we advance in years, we virtually don't have any stem cells.
That's actually probably why we age.
Well, it's certainly a reason why someone had to come up with a much more potent way of resolving these problems.
What's the age, because it's kind of shocking to hear this, that you stop producing these millions and millions and trillions of stem cells?
When I speak to audiences, and I'm speaking in front of groups, the median age is probably in their 60s or 70s, and they're in a way not surprised that maybe they don't have many stem cells, but I say, look, don't feel bad, because after the age of 15, here we are working with these youngsters on the TV set that we're on. After the age of 15, you have no stem cell. And I don't think anyone ever looks at a 15-year-old as over the hill. But when it comes to the ability to donate cells that are usable, the 15-year-old is over the hill and really doesn't have the volume of stem cells that one needs. Who really has them is that newborn baby.
And you think about it, from the birth all the way up until 15, 16, 17.
Real growth period,
you're
right?
growing, and so you need those stem cells to do that. When
Exactly.
when that signal is turned off, there goes the need.
So autologous is where it began, and I believe, unfortunately, even to this very day, 90% of all stem cell clinics in the U.S. still insist on using the autologous form of stem cell. I believe they're trapped in a time warp, these doctors. This field has grown and gone beyond them, yet they continue to use that ancient
Well, that happens,
approach.
I think, with medicine in general. You get stuck in a box, and that's what always impressed me about you, is you're well trained in that box, but you educate yourself and are always searching to expand the boundaries of that box. I do the same type of thing. I'm always learning, researching, because there always are better ways. You know, one thing that I was taught yesterday changes tomorrow, and if you don't change with it, you're stuck, and maybe even doing bad medicine. So you have to keep up. You know, it isn't you go to school and you learn what you learn and then you stop. You have to constantly grow because things change on a daily basis, and your whole office was based on that. From what I saw you doing, everything from vitamin C IVs.
a lot of unique treatments.
Using electricity.
One of a kind.
Absolutely, using electricity. I mean, I know this personally because I've been treated in your office with some of these things. You know, to use electricity makes sense to me because we are nothing but electricity.
Microcurrent. Let's not think.
Well, yeah, you're not
the key with the kite.
No, you're not doing that.
No, microcurrent.
Yeah, but that's electricity. Microcurrent is electricity.
Electrical, and we're energy beings.
We're energy beings, and medicine doesn't recognize that. Even though they test our brain waves, they test our heart, they do all these things with
very
electricity.
uncomfortable to entertain the medium of energy and utilizing it in order to get to better the patient, whereas the Orientals, 5,000 years of this chi, this energy, and the ability to maneuver it and balance it, yin and yang. Now, who has it right, Dr. Ed? The Orientals of 5,000 years worth of established, tried and true, or we Westerners in the last 150 years with our form of medicine?
Well, I think we do, especially in this country, a great job of rebuilding trauma cases. You know, you have a heart attack, we can intervene and do something about it. You break a leg, you're in a car accident, I wouldn't want to be anywhere else. But you're right. The Asians 5,000 years ago were using acupuncture to stimulate those electrical impulses.
Exactly.
And all the hormones that get stimulated in the process. And the problem, I think, in this country is most medical practitioners aren't integrating those two things. You do a lot of that integration, and I think that's what makes you stand out among the practitioners in this area, of
Our
course.
medical training doesn't prepare it for this. This really has to be something that you learn outside of it. Once you do and you embrace it, it explains a lot that Western medicine can't explain.
Absolutely. So we look at the stem cells, and the better way to do it is to get the stem cells from the placenta because they're in abundance.
Get them from the newborns, and the best source, I believe, is the umbilical cord, because this organ is just loaded with stem cells. And when they hand off that organ to the awaiting surgical team and head on back, it's really the stem cells themselves are found within the cord, not in the placenta, within the cord.
So what are some of the diseases that these stem cells can treat?
Well, we started our conversation by literally allowing the listener to fill in the blank, but for sure, this all began in terms of the medical use of them with joint disease, and to even to this very day, joint issues are the primary reason that people seek help from
So what's the number one joint disease?
Well, usually it's arthritic conditions.
And why does arthritis develop?
Well, over the course of time, I believe a phrase that I keep hearing, bone on bone, wear and tear of these joints through abuse ultimately leads to the initiation of an arthritic condition.
So it starts an inflammatory response?
It starts as an inflammatory response, and pathologies advance and ultimately distort the very architecture of the joint. All sorts of portions of that joint literally are destroyed.
So inflammation in our body is necessary, or we wouldn't rebuild or heal if we had an injury. The problem is chronic inflammation.
Well, with the chronic inflammation, there will be more destruction over time, and patients will tell you, well, I say, when did your knee pain begin? And they're now maybe 62, and they say, well, when I was 40, I was in an accident, or I fell. And what started out as just a minor bothersome annoyance has evolved gradually to a major league incapacitation requiring the use of canes and walkers, and the orthopedic surgeon is just a beck and call away from their ultimate correction, which traditionally has been the knee or the joint replacement therapy.
Which is some type of artificial
titanium.
So what are some of the side effects or some of the negative aspects of having the surgery done?
Oh goodness, look, these orthopedic surgeons are so skilled. As an anesthesiologist, which is my specialty, I observed this operation done routinely as part of my daily job. I had to anesthetize the individual so they could have the surgery, and I'm awestruck by the skill that this profession has. However, this is major invasiveness. You're going to have to detach, remove the joint, the femoral and tibial component of that person's knee, if we're talking about the knee, and then you're going to have to replace it with titanium that articulate and allow for movement once again. A lot of factors weigh into how this ultimately is going to turn out. We hope, first off, I think, if I've observed anything, that the person's pain and discomfort can be relieved. So that was the major reason that led them to consent to the surgery anyway.
Yes.
So let's hope that in all their cases, at least that got done. Now, beyond that, there are mobility issues, ambulation issues, rehabilitation issues that everybody was going to have to be involved with, and how well that joint is able to perform, now that's a different story altogether. So we hope the pain is alleviated, but the use of that joint is never really certain on how well it's going to be able to perform.
And then there's anesthesia risks, there's infections risks during surgery, and even after surgery, you go to have your teeth cleaned, have a prophylaxis, you have to take an antibiotic because the bacteria that's in your mouth can migrate down to that knee and cause it to fail. How many times in a lifetime can you do a knee replacement?
Well, no one, and they always wait until you're old enough. I say to a 40-year-old, you're really in a bad situation, because the ultimate correction for your knee problem is 20 years away. There's no orthopedic surgeon that wants to do any joint replacement in a patient that's too young, because the joint can't last more than 10 years. So yes, there are redos, probably 2, I'd have to say max 3, but each and every one of these is more difficult than the one that preceded it, and are very much frowned upon by the orthopedic world, who would prefer to have that first procedure delayed so that the person can literally outlive the life of the joint itself.
And it gets worse for hip and shoulder.
All 3 of these are replaceable. All 3 of them have degrees of recuperation and return to function, and that's never really. There's no guarantees here that this is going to give you what you're looking for.
Yeah.
So stem cells has been a wonderful way for the person to do what I think everyone should always do, and that is, okay, we have a surgery, we have these skilled people that can perform it, but surgery should always be the last resort.
I agree. Always the last
And
resort.
if we just kept, and the rule, I think everybody knows the rule, yet because in our medicine, the joint replacement is what's offered as the only resort, then it really is the last resort.
But we're changing that. We're changing
But
that.
that is changing.
With education, we're changing that with procedures that you do in your office. We're going to have a break right now, Dr. Courtney. We're going to be back. Tucker and I will be back. Tucker's asleep here. We're going to be back talking more in depth about the procedure that's done in your office, not in a hospital, for stem cells, the outcomes after stem cells, and then we're going to talk about that new technique, procedure
new
protocol
player.
called
Sure.
exosomes. We'll be back at Healthy Pets, Healthy Owners. Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we're talking about regenerative medicine today with Dr. Dennis Courtney. You know, Dr. Courtney, right before the break, we were talking about diseases of the joints, which is afflicts many people, from injury to just neglect and so forth, and abuse. But I want to backtrack a little bit here, because I think one thing we didn't talk about when we were talking about the harvesting those cells from newborn deliveries, is there any process that you're actually tracking the mother while she's pregnant?
So look, in the world of homologous cells, we have, it all started with something called banking. And by the way, banking has really grown into become much sought after and easily found in any obstetrical unit in the country. The couple who are just about ready to have their baby are given an opportunity, if they would like, to have the umbilical cord cells of their own baby involved.
Oh, what's the purpose of that?
Well, because they then will cryo those cells for the use in that baby who will grow into an adult, because they'll cryo and freeze those over 20 to 30 years.
So you're getting the abundance of the stem cells that you could use when you're 60 years old.
And because we know the mother here, the biggest issue of maternal health is already won. We know the mom. So the public wasn't able to be involved with that kind of a donation. That was only meant for the family. So public couldn't participate. they did come up with a way to allow the public to in the door, and that is how we're talking about this today. So what they did was develop a system where moms who had previously delivered by C-section could make a donation. They could volunteer, make a donation to medical science, and in so doing, allow themselves to be screened for maternal health issues. And after an interview process, which is the first hurdle, was successfully passed by the woman, then the investigation with various lab testing to find out if any disease exists within that mom and that could have a maternal health issue that could be passed on. Once we're sure that is not possible, then we accept her donation, which, by the way, she is not allowed to be offered not even $1 for. This must be a pure donation. After all, these products are considered medical waste and would be discarded as medical waste if they weren't donated anyway. So they make those donations, and everything is kept as well as it can be in terms of health of the recipient, because we're very sure that the health of the donor is such that we don't have to worry about maternal disease.
Can a stem cell be diseased?
No. The DNA and so forth is going to be intact. They are examining these tissues to make certain that the DNA is intact. So, no, I don't believe that there is a problem.
For the audience's sake, I just wanted to say something about stem cells. You can literally, this undifferentiated blank cell that has no identity whatsoever, you can take that cell, put it on an ear, and it becomes an ear. Put it on a nose, it becomes a nose. So that's how important these stem cells are for, I think, our longevity and wellness.
Yeah, a stem cell can turn into any cell. It may have started with the joints. I believe the highway is going to be cleared to involve every organ in the body. We're not there yet. We're getting there. The public, we hope medicine demands that we get there, because these body parts, if we could rejuvenate them and repair them, are able to be done so without any risk.
And we don't need to replace them.
And we don't have to replace them.
So these diseases of the joints, like arthritis, actually, you're undoing all the pathology by injecting stem cells into the joint.
You're not undoing. What you're doing, the stem cell can only read one code. And that code is the recipient's DNA. And that DNA in the person who's getting the stem cell is exactly the same. Now they're 63 years old, but that DNA is the same DNA as it was at the moment of their conception. What has happened, however, is they have supplied the pathology. We say osteoarthritis is one of the major reasons why people do end up getting stem cells for their joints. But that was brought on by that patient in the abuse of a lifetime.
Diet, sedentary lifestyle,
whatever. That has led to it. But whenever you administer the stem cell, pathologies aren't read by a stem cell. Only the DNA, the original DNA.
So it can never become a disease.
It can't become a disease because that's not found in a DNA code. You supplied it, and therefore that's why you have the problem today. But the original code has never changed. And that's the map, the code that gets followed.
So what is this procedure like if I come in as a patient to your office?
It's pretty much very innocuous. So I always like the knee. People can sort of visualize it in their mind. So we got these two bones, a larger one above, femur, rests on the head of the tibia, the bone at the bottom. There are 5 tissues in this joint: the bones themselves, a membrane around the bones called the synovium. It's like a lubricant tissue. There's cartilage in between the bones. In the case of the knee, it's called a meniscus. And then there are ligaments and tendons that strap these two together. And it's all surrounded by a capsule. Every joint has that same setup, same 5 things, same capsule around it. So when I administer stem cells, I need only get inside the capsule. And in the case of the knee, I deposit these stem cells in between these 2 bones. This takes probably 3 seconds, 4 seconds to enter into the capsule and to be in between those 2 bones. Another 4 seconds to administer the stem cells, and then we're out.
Do I have to do anything to prepare myself before that procedure?
The only thing I don't want to have involved with the person as they're approaching our time we're going to do it, I want them off of all non-steroidal anti-inflammatories, which just about all of them are on.
Yeah, or some type of painkiller.
Yeah, so the ibuprofens and the Aleve, because these poor people utilize these to get relief during the day. Unfortunately, however, they are anti-inflammatories. I know that's why they're taking them, but I need an immune system that's fully engaged. So I have to have people off of their NSAIDs, non-steroidals, for at least 72 hours, and off of them after the procedure for another 72 hours. So that span of 6 days, you got to be clear of any interference with your own immune system. That, except for no major overload of the joint, would be the 2 precautions that I'm concerned with.
So you can do normal walking and
Oh, you have to be involved with life.
Yeah.
So you have to, your bedroom's on the 2nd floor, you've got to walk up the stairs, but I just can't have, like, if somebody told me, like, that they do jogging, I can't have you jogging because I can't have that joint pounded, being traumatized like that. But just doing the things of daily living, they have to do them.
And when do patients start to see a change in that joint?
From the day we administer these, I've actually had some pretty amazing, like some people have said, not frequently, but enough to at least allow me to take note, the next day. Well, I'm very impressed. The way I usually explain this is to tell a patient, look, you don't have to get any known feedback of improvement up to a month. So don't get concerned or worried that this isn't going to work for you. At least 1 month should go by, because at 1 month I'm going to talk to them and I want to ask them one question, and that question is, what percentage of improvement do you have? It's been a month. How much better are you now than you were when we first met? And all I want to do is document that number. There won't be any need for a discussion here because only the patient knows what that number is, and I'm going to implicitly trust them. But once these differentiations, as you've used the word, have been made, then the cells divide. And they literally double every 3 to 6 weeks. I start out with 10 million cells. But 3 to 6 weeks later, we're now at 20 million. And 3 to 6 after that, 40 million, 80 million, 100. So pretty soon, critical mass gets reached and the joint gets regenerated to form a brand new joint where the old beat up and clackety one used to exist before.
So 6, 8, 9 months, right in that period?
I say that by the time 6 months rolls around, enough divisions have occurred that there's no need to further wait to decree how well this went. At 6 months, whatever you got, I believe is what you're left with.
So is it pretty much a one and done?
For these major joints, it's pretty much one and done, at least with the number of patients I've had over was coming up on my 4-year anniversary in December, I've only had 2 patients that ever come back that have asked to have another injection out of now maybe over 500. This is my own set of numbers, so I'm feeling pretty good about this.
So they felt they were about 80% and they wanted that 100%.
I allow you to be greedy, but you got to wait 6 months to exercise your greed. So if you said, look, I'm 80% better, but I want 100, then the only thing that we can do is re-inject. But that's only happened twice.
So this procedure is done in the office in a very short amount of time. Is there anesthesia involved at all?
No, because all the nerve endings reside at the level of the skin, I use a ethyl chloride spray. It's very cold, and it literally freezes the skin. So when I pop through the skin with the needle, the nerve endings are there, and they're knocked out. And there's usually no sensation whatsoever once I get beyond the skin.
There's several people that I know that have done the procedure at your office, and it's varied everything from knees to hips to shoulders. The only thing they told me is they felt sometimes a little bit of pressure initially, and that was it.
Fair enough.
Yeah, no pain whatsoever. And every one of those people that I know had a marvelous recovery. I mean, they're...
We got a good string going with the people you've referred to me, Dr. Ed.
Yeah, I refer to you as Dr. Stem Cell, but I take on that educational process too. But I just say you got to talk to Dr. Courtney, and one of the ways that they can talk to you is coming to the monthly seminars that you hold here in Pittsburgh.
We have got to educate the public to allow them to move out into the marketplace. Coming to I call it Stem Cells 101. I think that's a pretty appropriate name for it. It's the beginning course in any university level program that's offered anywhere in the country, 101. And so I believe that in about an hour, I can educate the public to such a degree that they literally can move into the marketplace if they choose to, because they are armed with 7 questions. I call it my 7-point checklist. That to move into the medical arena without that checklist, I'm fearful that something's not going to go right.
So you're educating whoever attends your these seminars are free.
That's
but
right.
You do have to make a reservation, and we have the phone number up on the graphic here for the audience, so they can call in and do that. But you can ask any physician that's doing stem cells these important questions.
I teach you these 7 questions so that if you have a desire to move out in the medical community, with those 7 questions, you'll be able to determine which stem cell you're going to allow to be used. There's quite a variation out there in these 7 companies and how they process, and some of their practices, I believe, are quite questionable. So the public who would never know what these areas are, once you teach them, then they can go up against anybody, and they are a force to be reckoned with, because they cannot be manipulated by some sales technique, which unfortunately in some cases has been reduced to like a used car salesman kind of a thing, and I think that's terrible.
Well, that's the power of education. It empowers you.
That's that education.
And we use this word interchangeably. I used it independently, and Dr. Courtney used it. We love that word, empowering, and education always does that. So you have these seminars every month. They're free. You just have to make the reservation, and that's your Stem Cells 101. And then something you do every month is I invite you every month, and you always say yes, to come on my radio show on AM 1250. Healthy Pets, Healthy People. And I think the stem cell is so important for medicine and for your well-being. And Dr. Courtney comes on, and we take calls when people call in. We educate you as best we can on that radio program. And then we try to entice you to get to go to these seminars. Because one of the things that you can do this TV show and have a conversation. You can do the radio show and conversation. But there's a difference attending an educational seminar like the Stem Cells 101 and interacting with you in this group, because you engage the audience with your presentation. And so I often recommend to people, go to that seminar. You'll be amazed.
You've been there.
Oh, I've been there, and I threatened to come last week, and I couldn't make it. But we're gonna get it. I'm gonna attend one coming up, hopefully next month. But you walk out and you actually feel energized, because you're taking charge now. You have the information to take charge. And Dr. Courtney doesn't sit up against the podium. He's right in the middle of the audience, and people just talk to him as though you're their best friend.
They get comfortable.
Yeah, absolutely. And the nice thing about once you attend the seminar, you get if you decide to investigate this further, you get a free office consultation one-on-one.
Hey, look, after educating them and done the hard work, I believe once they're educated, if they have their health concern, their health challenge, I don't want to charge them to have the ability to talk to me one-on-one. So as they leave, they can schedule an appointment with me that I won't charge them for, so that we can get down to their particular issue. Because in that evening, we're not talking about their issues. We're talking about the stem cells in general and how you shop for them. And the nice thing is, when I finally do see them in my office, the first question I ask them is, now look, you were at a 101. Let me give you one more opportunity. Do you have any question at all about the stem cells? And almost to the person, they go, well, no. Would you know how nice that is to get that kind of feedback? Because you know that they're completely comfortable with what you taught them the previous evening or the previous week. And so they want to be able to talk about them now, because, when it comes to the stem cell, they know what kind of stem cell they want to have administered to them.
Absolutely. And again, I suggest, if you don't have a problem, you know somebody who does. And
somebody in the family too.
And you could take them, or you can go yourself and spread that education. It's unbelievable the knowledge that you gain. And I'll say this again, I think stem cell is the future of medicine.
I believe it too.
But there's something new coming up here, and you were the first to announce it that I heard in this area, and you announced it on Healthy Pets, Healthy People on the radio show. And I was honored that you did that. Would you tell us about this new protocol that you're doing called Exosomes?
Yeah, there's a new player. There's a new player in the world of regenerative medicine. I actually think it's going to overtake all the stem cells, just given the right amount of time. But these materials called exosomes, talking about stem cells and then they land and then they become the tissue that they land on, is a nice story to tell. But truth be told, the reason that stem cells can do what they do is that the membrane of that stem cell actually forms an ECV, which is an extracellular vesicle, and allows proteins found within the cell in the form of messenger RNA and microscopic RNA. That's as medical as I want to get right now on this show.
Those are heavy hitters.
Okay. But these are what end up telling the target cell what to do. So the fact that stem cells do what they do is by virtue of exosomes. I really never told that part of the story before, because it was like information you really didn't need to know. But when I found out that you could actually harvest the exosomes alone, and you could administer the exosomes without administering the cell, it was at that point that we had to reveal what was really doing the work here. So the final thing that won me over was, Edmund, I talk about stem cells that I administer coming in a little 1 milliliter vial, and I'm guaranteed in the company that I use that there are no less than 10 million cells in that vial. However, the first exosome treatments that I did, I saw the lot number on the exosome vial, which is also 1 milliliter, and I called the company and I said, hey, could you tell me how many exosomes are in this lot number that I gave them? And they said, give me a second here. So they went back and they looked and they said, okay, in that particular vial, there are 623 billion
Wow.
exosomes. And when I heard that, it all made sense to me, because 10 million cells, there are going to be a lot of exosomes that spill off of it, but there's nowhere near 623 billion. So if it's possible to administer the exosome and not have to administer it via the cell, I believe the exosome will be ultimate winner in this educational cascade that's now occurring. I've had exosomes available to me in the last 3 months. I'm a very happy doctor because I'm finding some amazing use for those exosomes.
Such as?
Well, I think for now at least, what I think I've come to use as my rule is if it's a joint, I'm going to use stem cells. The reason I'm going to use stem cells is my results are so good with them, I'm not going to disturb and upset that apple cart. Because I'm well over 90% of the people that I treat end up to be completely happy. Mm-hmm. That's a set of numbers you can't deny. However, if I want to treat anything else other than a joint, and I do, stem cells don't make sense, because stem cells get trapped. They're so big, they get trapped in the lung, because that's the first place all stem cells go when you administer them intravenously. And that's how I administer them. But what if I want to treat a kidney? Or what if I want to treat somebody who's had a stroke? Or how about somebody who's had a heart attack and their heart is really weak? Stem cells don't make sense, because I never can get enough of them to where I want them to land. Well, with exosomes, they're so small. They can, a stem cell can be seen with I think they were called Gilbert's microscope. Little kids get their first chemistry set. But you can see a stem cell in one of those Gilbert microscopes. An exosome can only be visualized by an electron microscope.
So you give those by IV, and they're such high numbers, and they go through your system.
And they're so small, Edmund. They're so small, they go through no barrier. There's no barrier to them. Lungs, go right through the lung. If I need them to go to the brain, they know where in the brain they need to go.
And they're going to do somewhat the same thing that a stem cell would do.
But in the place I need to have it done. Anyway, can you see the excitement here?
Oh, yeah.
I'm seeing some great things happening with this. And I'm also, yes?
Are they harvested the same way?
They're harvested at delivery, at a C-section, just like they once harvested only the stem cells. But with the sophistication that they now have, they can harvest the exosome alone from those same babies who are now seething in exosomes just as they were in stem cells.
So can this be used cosmetically as well?
Funny you should mention that, because yesterday I did. Women are coming at me and saying, "Hey, what are you doing for aesthetics?" So I had a young lady in the office just yesterday that we use now. We have topical exosomes, so we were able to treat her rosacea. Now it's only been 24 hours. I can't tell you how this has turned out, although I have people who have done this on women, and a lot of women that are asking for this, but the number of men is also rising too. So it's too soon for me to tell you that in my own experience what I'm about to learn.
But they suspect that it will.
But I'm expecting it to. I'm also expecting it for hair loss. I think there's a major way of getting that hair to regrow.
Used topically as well?
Topical. So between the topical and the IV administration, great utility coming up around the corner. These exosomes, I'll be talking a lot about them. I'll be learning more about them as time moves on. We'll talk about it every time.
We're at the end of the show. This show went by so fast. I think there's so much information that you delivered, Dr. Courtney. I want to remind everybody that you can catch Dr. Courtney right around the first or second Saturday of every month on Healthy Pets, Healthy People, my radio show on AM 1250, The Answer, 9 o'clock in the morning, and you can actually call him and call into the show and talk to him. We talk about a lot of the same stuff here that we talked about on the show today on Healthy Pets, Healthy Owners. Also, right around that same time, I said you can actually get it on WDVE. You can hear you on that station as well. Is it DVE?
There's a radio show that I have on stem cells, and it's on the Saturday morning at 10 o'clock.
At 10 o'clock.
On WJAS.
WJAS, following the AM 1250 show.
So right after, if
Yeah.
you didn't hear enough, you can move right to my own show.
Yeah. Would you come back to this show again and talk more in depth about this?
I always enjoy coming back.
I appreciate it. I thank you for this. You can catch Dr. Courtney at that Stem Cell 101, and I suggest you go see him on that. Thank you so much for watching Healthy Pets, Healthy Owners. Thank you, everybody. Appreciate all your help. Dr. Courtney, thank you for coming on the show.
Thanks, Dr. Ed, for the invite.
Remember, a healthy pet is a healthy pet. When you're healthy, you're happy as well. Again, you can listen to this live every Saturday morning at 9 a.m. on AM 1250, The Answer. Bye-bye. That was a wonderful.